Hello, welcome to today's episode of Medical Dialogues Presents Medical Perspectives. Today, we are going to discuss a very important topic, that is the topic of the transition of the examination system in this country, the transition of the highest order of examination system for entrance into the postgraduate courses, that is from the National Eligibility Entrance Test to the national exit examination, that is the NEET to next transition. And for this, we have a team of elite professors as well as students with us. I'd like to welcome Professor Ravi Kant, sir, the director of AIIMS, and I'd like to welcome Dr. Sakshi, who is a NEET PG aspirant, and Dr. Dhruv Chauhan, who's also an intern, a medical activist, and also one of the NEET PG aspirants. Yes, sir. Welcome to this discussion about the transition from NEET examination to the next examination. I also welcome Dr. Sakshi, who is a leader of Indian Medical Association Students Network, and she is doing her internship, and she is one of the aspirants of the NEET PG, and from now on going to be the next examination. Sir, first of all, I would like to come to you, sir, and I would ask you a very simple question, that are we ready for this transition? Is the country ready? Is the medicos ready for the transition which is happening from the NEET examination to the national exit examination?
Well, my answer is we will never be ready even after 10 centuries and maybe another 10,000 years. So that will be the last of the point. The key point is that the teaching standard in various medical colleges are so dissimilar to each other that sometimes we wonder before anyone uh, treats us for our disorder or our disease or our relatives, should we ask where you're passed from? And this thing should go. India must be a common standard and therefore a common examination. And that is a pattern everywhere in the world. So there is nothing new, nothing extraordinary. Government is on the right track.
Sir, one question which I would like to ask you then, sir, what is the need of having universities, UGC regulation, Medical Council of India regulating all the medical colleges, all the academic programs, academic calendars, guidelines which is given by the National Medical Commission, and the autonomousity and the power which is given to the AIIMS institution to conduct their examination? Are they not teaching well, or are there examination system not fair? Are they not producing doctors?
If the
And
voice is,
if such
if the,
colleges are
if,
not producing doctors,
no,
then why
no,
are we even
no,
giving
no,
them permission?
my point is very simple. If the voice is raised, it means you lost your point. So let's have a civilized debate, not an emotional debate.
Yes, sir.
Let's see America. You have heard the name of best of the universities like Harvard, Stanford, UCLA, Yale, UPenn, and all Ivy League universities. Now, don't tell me that they don't have autonomy and they don't teach well. But who examines their MBBS and PG student? Is the Central American Board. The name is different, but the board is central. Is a federal board, is a federal exam, right? University exam simply says this, that okay, you can carry on, but it does not mean that you can go ahead. Similarly, in America, there is a dental course which is done by many universities. So you pass the examination. There are three types of examination for dental you have to pass. Number one, US Dental Board 1, US Dental Board 2, then the university exam, and third and finally, federally regulated two exam, that is US Dental Board 1, US Dental Board 2, and the licensing exam. So three exam are central, one exam is this only university exam. And you have to pass all four examination, all three, all of those, not one of them. So let's not be misguided by emotional UGC, all that. You can't teach Harvard what is UGC. You can't teach Yale what is that. They have gone much beyond that level. So let's be realistic that some of the schools teach very well, exceptionally well. Some of the schools do not teach well at all. Some have got a opportunistic teaching that whatever cases are coming, only they are being taught. Rest the curriculum is not included. So let's not be in any what you call as euphoria that universities are doing a good job. Universities are doing what is available to them, which may not be ideal. So let's follow this point and concede that the America is doing for last 40 years. The England is doing for quite some fair amount of time for PG, as long as you remember the Royal Colleges. So there is nothing new in it. There is nothing. Similarly, Australia is doing, at least I have seen for last 45 years, same thing. So there is nothing about exciting about it. The key point is we are now correcting our course and the government action is correct.
Dr. Sakshi, how do you take it as an aspirant? What is your perspective in this with this transition of phase, and it's an end of an era where the eligibility exam will not be as it is known to all of us present here. As sir is saying that it is being done for 40 years in various other countries, in US and UK, there are various licensing exam that each and everyone has to pass. But when you took admission, you were not aware of this situation that this will be your plan of exit. So how do you take it as an aspirant and as a student?
Uh, Thank you, sir. With all due respect, I definitely agree with the point of sir that the uniformity is currently very, very much required in this country. Uniformity in the manner of examination. But sir, what I would say is that it should be there should be a clarity from NMC's side. Like if I enter my MBBS, if I enter my medical college as a first year UG student, from that very point it should be clear to me what kind of examination I'm going to appear on. It should be clear to me if I'm going to give this national exit test or if I'm going to give the NEET. It should be clear to me from that particular point only. So the clarity is very, very much required from NMC's side. Definitely NMC has recently released a proposal of a proposed guideline, and it has also asked for the suggestion for the comments from the stakeholders, which is highly appreciable that they are taking our suggestions. But there are few things that has to be very, very much clear, like which batch is first going to appear for the next examination, sir, because there's a huge lot of confusion and uncertainty. That is the main problem currently. The whole chaos, the confusion, that has to be clear. So that would be a demand from the NMC, that has to be clear, because sir, if NMC is planning to take this next examination from 2019 batch, let's suppose so, sir. Next is a replacement of third prof and final prof part 2. But the 2019 batch, in upcoming 2 months they'll be appearing for their third prof examination. So once they have already cleared their third prof examination, they have passed and they have entered their final year examination, then why would again in the final year to get the license, then again why would they appear for the third prof examination? So there are certain things which has to be cleared, because students are in a huge dilemma. That has to be clear from the NMC side. A huge problem that we will require the NMC to clear as soon as possible.
Sir, two things are coming from gist of Dr. Sakshi's comments. One is that the rules of the game cannot be changed once the game has already been started. That is that when they took admission, they were kept in. It was kept in their mind that they have to give the NEET examination, they have to give the university examination, and that was the rules of the game when they entered the college. So now the uncertainty lies that how this examination will take place, and it is an undue advantage to the batches who are going to take this for the very first time. And secondly, about the lack of coordination and planning of for the implementation of the next exam, because NMC itself seems confused about how, when, and where and why it is going to conduct the examination.
Okay, if you allow me to answer without raising my voice, and I appreciate the thing which Sakshi has said, I think it is a frog in the well theory. Do you think the university examination, which is done by, say, Harvard University, they don't do comprehensive examination? Still, that child in the dentistry has to do US Dental Board Part 1, Part 2, and the license exam. So that is not an excuse that whether you have to do one time or two times, that is a very minor issue. The key point is, end of the day, I want to know whether my intern is taught in outcome-based methodology. That is what the focus is. And NMC is absolutely right, and there is no confusion in their mind. It is only the, I would say, some friends like Sakshi who are bothered, and our dear Krishnan, you are working now in MAMC where I taught almost 25 years. Do you think the standard MAMC is same as some of the 100-kilometer away medical schools in NCR? Do you think same? If they were same, why you would join MAMC? Why not in them? So issue remains there are some island of excellence, but majority are definitely not. That I am pretty emphatic because I have first-hand experience. And in order that human health, human welfare is the topmost in agenda in the NMC mind. So they are absolutely on the right track in putting some minimum standards. They are not putting maximum. Please remember, in Middle East, it's a 6-year MBBS and minimum marks to pass are 60%. In Boston University, for admission, you should have 85% and above total, I would say, average and not merely percentage before you can enter. So each university, there are so tough, but still the examination at the end of the point is 3 federal examination. So let's ignore this concept that NMC is not clear. NMC has thought out well, they have deliberated well, and it is had been thought of and it will be done. So on, no confusion about it. About whether you are in midway or this is a very small advocate point. I consider a very, slimy legal point when we are talking about. Suppose your relative come, will you think the MAMC will give a different treatment and 200 kilometers away some other medical school will give similar? Answer is no. Still today, no. Neither the facility nor the expertise. I'm very sure of it. So the key point is now everyone should give the same treatment to my relative. I am driving from Dibrugarh to Trivandrum. I can meet accent anywhere. I want uniform treatment. So Sakshi and all are just because they are kids, they are getting not only disturbed, but they are agitated. And this agitation and disturbance is losing the clarity that what NMC is doing for your parents, your relatives, your friends, and your population.
I agree. Dr. Dhruv, do you agree with sir? Sir is saying that yes, minimum guidelines should be set up for everyone. If someone who is getting the medical training from AIIMS having a good medical expertise, and someone who is getting a medical training from somewhere in a very remote areas who are not studying properly, why should both of them be given equal chances? They should prove themselves by having a common exam. That is what sir is saying, that you have to pass, and a minimum guideline and a minimum setup that should be set for all of them. It should not be a free cake after you just entered the MBBS courses. How do you take the next examination, and what are the perspectives of students that bother them, Dr. Dhruv?
Uh, so sorry, actually I could not hear the question from the starting due to some network problem.
I said that sir is telling us that it is important that there should be uniformity in the medical field, in the medical education, and whatever treatment someone is giving in Delhi, same treatment should be given in Bhubaneswar or somewhere in a remote area of UP and Bihar. Why there should be so much difference in the treatment, and per se the difference in the treatment, according to sir, is because of the difference in expertise and their way of care. So why not have a common examination where everybody proves themselves? So how do the students take it? How do you take it as an aspirant who is going to give the next examination?
Yes, sir. Sir, basically, we can see this exam as an another perspective of USMLE and PLAB also. Like in other countries, we have USMLE, we have a common exam called PLAB in US and MRCS in the UK also. So just like that, we will now have a common single exam for the medical entrance in India. Otherwise, what used to happen earlier, like we had a different separate exam for FMGs, we had a different separate exam NEET PG. Okay, we had two exams. Now combining the two exams will not only reduce the resources but also will bring the transparency into the exam system. Now this transparency, how will this transparency come? Earlier what used to happen, there was a different setup of system of internship in all the colleges of India. Like in south, there was this internship going in July. Then there is some other state internship was happening in another month. Now a single pattern will be used. There will be a single exam, and internship pattern will be same for all the students. The exam structure will be same for all the students. Now biasness, earlier what used to happen, there were a lot of complaints, like university examination, final university examination, there were complaints of biasness of the colleges. Like the university examination checking pattern was not similar for all the colleges, for all the universities. This pattern has been removed by next one, what we call the next one exam, hence bringing more transparency in the system, reducing more resources, and bringing more transparency in the system. Hence therefore this next will be a boon for bringing a good transparency and a more less less biased system of medical education in India, and a common entrance for a single for medical education in India, just like any other exam in other countries.
Dr. Sakshi, Dhruv is having a little different perspective than what you were saying. He's saying that there is a lack of transparency in the medical system. He's pointing out mostly he's pointing out at various private medical colleges where there is favorism and favoritism happening. And I must tell you, from being from a government medical college, this happens in government medical colleges also, that people get better marks if they are more close to professors, and people like us get a little less marks in the examinations. So, how much do you think that this is going to affect this next examination? So, there is few students pro next also.
Yes, sir, I definitely agree with Dhruv in that point that this transparency is going to be there. Definitely, I agree in the next one. But then again, what about next two? We have seen that next two, which is going to be take place after internship. Once you complete your internship in the month of March, most probably second week of March, they are going to take the next two examination, which is again going to be in the hands of universities only. And next to, if I'll talk about earlier, if the final year exams, which were the theory exams, theoretical exams, at least we had our marks. We could see our marks. That there was at least that much transparency. But in next to, what I read about next to is there's not going to be a scoring system. It's a pass or fail thing. And again, the university is going to take that exam. So what, where's the transparency in next to? We won't be even able to see our marks, like in what basis we were judged, or what if the management is in our favor, the management is going to pass. If the management is against us, the management is going to fail. So again, that is one thing where again we'll be lacking from the management side. Again, it's
Exactly.
in the hand of management. Yes, sir.
Exactly, I agree with on this point, because it is just the same medicine in a different packet and nothing else. Because if you read the act, the proposed examination system, The practical exam has to be done by the concerned university and the concerned colleges itself. So the part one examination, which is objective, it becomes like a NEET examination only, with where the MCQ kind of question pattern is there, and the part two examination, which has to be taken in the university, that the transparency
Exactly,
is
sir.
again questionable.
Even sir, the practical exam, even if we won't talk about the next two per se, if we'll speak about the practical exam only, to enter my internship, first of all I'll have to clear my next one, and then after 1 month my practical examination, which is again going to be take place. The university is going to take the practical exam, so if I fail my practical exam I won't be able to enter my internship, then again it's the same thing.
Yes,
So it's
I'll
not going
like
to
to
bring
come to
any
sir
particular.
and ask one thing, that sir, it seems that it is going to make the medical students more burdened, which they already are with so many examinations and the system getting tougher day by day. Another examination system, isn't it going to make them more tensed, and more stressful situation will be them for them? And also, sir, I would like to ask that is this the right time for it? Because with the COVID pandemic, with everything, there has been a lot of experimentation in the medical field, be it scrapping NBE, starting NEET, because NEET has also been started not more than 7 years ago. 2017 was the first time when NEET PG happened. So we have seen, and a lot of medical colleges are being opened. So there has been a lot of experimentation in the medical system.
Well, Krishnan and Sakshi, now you are speaking and I can see you, right? But you can't see me because I don't wish my camera to be on. So what does it mean? That if I wish to see how you are doing exam, I can do that without you seeing me. So NMC can organize a camera while you're giving exam, that it is fair or not. Point one. Point two about Krishnan. Point two, my answer is yes, this is the right time. Point three, if you see what happens in Maulana Azad in surgery department, one day we operate parotid, another day thyroid, third day thymus, 4 days something in the lung, then the stomach, then the colon, then the rectum, and so on. And I can tell you within 300 kilometers of Maulana Azad, what you see in OT, lab coli, lab coli, lab coli, lab coli, lab coli. So the curriculum is not there. So I will come to Sakshi again and explain better. Nowadays, the exam is not the way you are saying. The right thing for clinical examination is OSCE, because we have asked you clinical vignettes in the next one. When we do the OSCE, the term is objective structured clinical examination. Objective structured clinical examination can be documented by remote camera. Anyone sitting in the NMC or anywhere else, an external observer can be there. It can be easily instituted by a small flash, and the questions will not depend on what the local examiner is recording. It will be a very objective system, and OSCE is a fair and square. And why it has happened? Why it has happened? 30 years back, the Canadian curriculum changed to outcome-based curriculum. We don't bother what has been taught to you. We want to know by precisely what you can do. And the next two will be basically not what you know, but what you can do by hand. And that will be OSCE. And OSCE will be supervised, obviously. Uh, we can ensure that you will understand the meaning of double blind randomized controlled trial, and we remove the bias, so that can be done. And as my friend has already explained you, the biases are there, and there is a good step by NMC. I congratulate the government. It has to be done, and it has to be mercilessly done once you get habit to it. Because you went for first NEET. Initially, there was so much hula bulu, north and so many states objecting. Then the Supreme Court said yes. Then there is a hula bulu on NEET PG, then on NEET SS. So it doesn't matter anymore. It has to be done. So gradually, you will also get accustomed to it. Don't worry. What Sakshi says doesn't matter in real life. What we need is Sakshi of Dibrugarh, Sakshi of Calcutta, Sakshi of Asansol, Sakshi of Bhopal, Sakshi of Trivandrum. All are competent. That's all we want to know. Nothing more. And there is no desire by anyone. In undergraduate examination, what is the pattern universally? Teachers want student to fail. Student want don't to pass. In PG, the plan is student want to pass, the teacher say, no, you are not competent enough so far. So what is being done in MAMC on a routine operation days, they get 6 theatre to general surgery per day. On the contrary, 400 kilometers away, another medical school, they get only 1 theatre a week. So there's a huge confusion. There is so much difference. It has to be uniform. It has to be proper. We want, irrespective from which state, which city Sakshi is coming, they are competent, good doctors, and we are happy that my relatives, my population, your population, everyone is treated well. That's all. There
Great,
is
sir.
no hidden agenda of either harm or animosity. That is not there. The seniors are like your parents, you're like your guardians. How can they think of harming you? You are our children. We have spent whole life in medical school.
Great, sir. Yeah, I completely agree that this step is a very a far-sighted step. It has to be taken up, but I think that the professors and the National Medical Commission should be merciful to those students who are actually not studying in Maulana Azad and are studying 300 kilometers away. It is not their fault that only lab chole is being performed in their department. So we have to be merciful towards the students, and I hope that this examination system takes the examination of the minimum criteria, that is the minimum that one should know, and not the expertise of the criteria, so that all the students feel welcomed and secured. And obviously there is no correct time, there is no correct step time whenever it will happen. Some of the batches will suffer, but let's hope for the best, and let's hope that a few of the demo test and whatever more help NMC can do to the student is being done. I would like to
Ron,
thank
just,
you,
Ron,
sir.
just a small point. Ron, just a small
Yes, sir.
point. Let's be clear what we want. We want MBBS doctor in a primary health center, what they will do. That is the standard you will be asked. It will not be from a specialist who is operating thyroid. We just want someone who is under PHC, how he will handle the village folks. That is what the minimum standard is, and that is what will be implemented. There will be no hi-fi examination of asking you too much of blood gas, because that may go some beyond the point. So the key point is, aim of MBBS is village controlling doctor situated in PHC, and that is what the standard should be, and that is what standard will be.
Absolutely, sir. Absolutely. I completely agree with this because it is going to strengthen our country's healthcare system if it is implemented in a proper and a channelized manner. I thank you, sir, for joining us, and I thank you, Sakshi and Dhruv, for joining us. It is a topic which could take hours, but that's all of the time we have for today. We will certainly meet again and have some new topic of medical discussion, and let's wrap it up here. Thank you once again to all
Thank
and
you.
each and
Thank you very
Thank,
much. Thank you.
thank you so
Best
much.
Thank you,
wishes.
sir.
Best
Thank you
wishes.
thank
so
you.
much.
Bye bye.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.